Okay, thank you very much, Minky. It is time for our vet specialist segment today, and this morning we are discussing a condition that is called tooth resorption. And to tell us all about it today, Dr. Jerome Williams from Red Mountain Animal Clinic and Dr. Bert Gaddis from the American Veterinary Dental College, because he's an expert in that area. Good morning. Good to see you. And Jillian front and center here, as you can see.
Yes. It's always good to have Dr. Gaddis here with us. He gives us so much information.
So I would imagine when you get somebody brings their pet in and you can see there's something going on that he would have to see. What are you finding when you see that?
If I see some abnormalities in the mouth that I don't really understand, then I will call his office and do a referral to him.
So what is that, Dr. Gaddis?
Tooth resorption is a condition, I compare it to a cavity.
Okay.
It's a condition where we don't really understand what causes it, but it starts as a small lesion on the tooth, causing just like a cavity, a little bit of a caries that eats into the tooth.
So is it visible? Is it?
Here is, this is a kitty cat, their left side, and we're missing the very first premolar, the last tooth, and then we have an X-ray that shows that first tooth. There's just a little bit of the crown. It should look like the tooth behind it, and then the very back tooth, there's kind of a little cloudy area, a little lytic area that's darker, where this resorption is eating away at that tooth, and this is a progressive condition.
So that's it there.
That's the same cat the other side. So we're looking this one.
Like that little red dot that's in the middle of the screen. That's
that's the tooth resorption on the tooth.
Okay.
And there's the X-ray.
So is it painful like a regular toothache?
It can be very painful. Sometimes with these cats under general anesthesia, when we touch the tooth, their little jaw will chatter.
Ooh.
Sometimes they're not eating well. Sometimes they're just kind of gulping their food. So it can be a very painful condition.
What causes it?
We don't know. We don't know what causes it. We see it in about 30% of all cats. We also see it in dogs. And the treatment is to extract the tooth. We can't do a restoration like you or I would get to a cavity. That doesn't stop the process.
If you look at the gum line right beneath the tooth, it just sort of like something just filed all the tooth material away.
And so this could be going on for a while, I guess, before it's noticed, couldn't it?
It can. It can go on. That particular cat had one that, had two actually, that were pretty well involved, and then another one that was very early in the process. And so it also happens in dogs, though. And we had a picture. Here's a picture of a dog. That biggest tooth in the center is the first molar, and that gum shouldn't be growing up on the side of that tooth like that. So when we take an X-ray, we see how the back root is normal, but the front root, there's something that's literally absorbing the tooth, resorption, eating away at that tooth, and again, can be a very painful condition.
The more darker appearance, that he's put that down now where we saw the tooth, is that the absorption taking place?
That's where it's being resorbed.
All right, so just more reason to have our pets checked regularly so that you can notice something like that and then see a specialist. All right, Jillian, good to see you. You had so much to say today.